We're going to begin in just one moment. Okay, good afternoon, everybody. I am Jessica Melman. I'm the Chief Planning Officer at Jewish Federation of Greater MetroWest, New Jersey. I am so glad you are all here with us today. This presentation is in webinar format. You can see us and ask any questions using the Q&A or chat feature below. Please ask questions as they come up, and we will answer them at the end of the session. The Jewish Community Foundation of Greater MetroWest, New Jersey's Center for Strategic Philanthropy is proud to present this series, The Greater MetroWest Response to COVID-19. Today's topic is food insecurity throughout our Greater MetroWest community, which includes Morris, Essex, Sussex, Union, and parts of Somerset County. Together with JCF, Jewish Federation of Greater MetroWest has raised and made available almost $6 million to help support our community around the world immediately during this crisis. Over the past 3 months, Federation has provided direct grants totaling over $1.5 million to our local agencies to support services that are a direct response to the COVID-19 crisis, including funding to help combat growing food insecurity, mental health needs, medical and cleaning supplies, and community outreach to our most vulnerable populations. In addition, we have raised over $20 million for our UJA Federation annual campaign that will be instrumental in helping our community rebuild as we come out of the acute phase of this crisis. I have lived and worked in this community for over 20 years, and I have never been prouder to be counted as part of this community. I hope you all feel the same. Before I introduce our speakers today, I want to note that the topic of food insecurity is an issue our community tackles every day. We were deeply involved in this space before COVID-19, and that existing infrastructure made it possible for our agencies to pivot quickly once the pandemic hit Greater MetroWest. Food insecurity is real in our community. Whether it's the kosher food bank, distribution of grocery gift cards, Meals on Wheels, or one of our many congregate meal sites for seniors that provide relief from both social isolation and hunger, Jewish Federation and our partner agencies remain at the forefront of fighting to keep our community healthy and safe. Here today, we have Diane Squadron, Chief Executive Officer from Jewish Family Services of MetroWest, and Tom Beck, Executive Director, and Ellie Bodner, Director of Community Engagement at Jewish Family Services of Central New Jersey, to speak about how we are responding to the crisis. So I'm now happy to turn this over to Diane.
Hi, everyone. My name is Diane Squadron, and I'm the CEO of Jewish Family Service of MetroWest. I want to thank Jessica, the Jewish Community Foundation, and the Jewish Federation of Greater MetroWest for inviting me and JFS to come on and talk about food insecurity and what our response has been to what we've been doing. So I want to spend a few minutes walking you through our response that started really on March 13th, on the day that we shut down our in-office services. We knew almost immediately that there was going to be an increased need for financial assistance. We were concerned about our older adults who live on a fixed income. We were concerned about our Holocaust survivors who have experienced food insecurity at an early age and what this might bring up for them and what we could do to help them with this. So we were starting from the very beginning to look at the different options that we had to work with all of our different members. And we also were concerned about our volunteers who wanted to help, and we wanted them to help, but we also wanted to be able to keep them safe. So if you see now up on the screen, there are pictures of many of our volunteers food shopping, delivering food, all wearing masks, all just with one person who's clearly a family member or on their own so that they can keep themselves safe. We were thrilled with the response that we received. We were very pleased with Federation, and we're so grateful to Federation for their offering, for their response and the funds that they gave us to allow this to continue. So we set into place a few different systems immediately. One of them had to do with how we were giving out financial assistance, who could get it, how they were going to get it, how we would send them the gift cards, because none of that is easy when you're not sitting in your office with everything right at your hands. And we experienced, particularly in March and April, a huge upsurge in the number of gift cards and the number of people who needed financial assistance and were looking for ways to get food. We also knew that for some of our older adults who were isolated, did not have family around, were living on fixed incomes, that we had to find a way to get food to them, that we couldn't just rely on their being able to come in for a gift card or our being able to send them a gift card. We needed to do more than that. And so we very quickly set up a system where we had volunteers who would go shopping for our older adults and then leave the deliveries with them in a non-contact way. And while that sounds like a fairly easy system to put into place, there were a bunch of different issues that came with it. Some of our older adults could sometimes afford to pay for the food themselves. And so then we had to work out a system of their giving us the money to pay for it. Some of them were on food stamps, and we needed and wanted to use their food stamps to be able to get their food. And so we had to work out that system. And some we were providing the gift cards for. So while each piece in and of itself feels simple, putting the whole thing together was rather complicated. So we worked really hard to do that. And what we've come up with is a 3 or 4 tier system that involves providing gift cards to people in need within the community, having volunteers go shopping for older adults, particularly the isolated older adults who didn't have anyone to do that and would be more vulnerable if they went out into the public, and providing meals for both our Holocaust survivors and other older adults who would benefit from a Shabbat meal, from knowing that they weren't forgotten. And as you can see on this slide as well, we also had board members, our Next Gen committee, and other people saying, we'd like our children to make thank you notes. Our children want to do something. They want to help. We want them to help. Can we drop off thank you notes that you can include in the bags? So we organized that part of it as well. Our staff have been amazing in pulling this together. We'll get to the stat slide in a second, but I want to tell you that we have seen an increase in financial assistance of 10 times what we would be doing normally. So over the last 3 months, as opposed to 2 or 3 gift cards a month, we're giving out 20 or 30 gift cards a month. And we're providing kosher Shabbat meals, and we're providing lunches, and we're doing food shopping. So all of this has been a huge support for our community, I'm hoping. We're appreciative again of Federation for allowing us and helping us to do this. Just to give you a few stats, we've shopped for 39 clients in total. And again, we really work to shop for those clients who are isolated older adults, who are vulnerable, who don't have someone to shop for them. And as you can see, we tend to do multiple shopping trips. I want to tell you about this number because we started out in March and April, with 2 or 3 clients a week. And we're up to now, I think it's 15 or 20 that we shop for, and we tend to do it on an every other week basis. We also coordinated with a kosher caterer to provide Shabbat meals, both to our Holocaust survivors and to our isolated older adults. And we have 28 volunteers who come in weekly and deliver those meals. We recently put together 140 care packages for our Holocaust survivors so that they would have some of the necessities that were very difficult to get, particularly at the beginning: paper towel, toilet paper, some dry goods, non-perishables, tuna, canned fruit, things like that. You can see we've had 73 volunteers for shopping and delivering meals. 75 clients have received gift card. We've given out over $7,000 in gift cards and financial assistance. And that's more than 10 times what we do typically. And also 92 lunches have been delivered to our Russian survivors who had very specific requests for what they wanted, and we were pleased to be able to accommodate that. We are this week also starting our Cafe Europa up again virtually, and we will be providing meals for our Cafe Europa lunches for during the virtual event. So it's definitely been a learning curve. We know that it's not over. The additional unemployment incentive of the $600 a week slowed down the financial requests and the need for support for food a little bit towards the end of April and into May. We are anticipating that that's going to go up again, and that the need coming into July, August, September, really through the year, is going to more than double what we've already done. So any questions I know I'll be able to answer for you at the end, and thank you so much for everything that you've done.
Thank you very much, Diane. It's now my pleasure to pass the baton over to Tom Beck and Ellie Bodner.
Do you see us? Are you able to see us now? Okay, so I'd like to welcome everybody to our community vegetable garden that we have here. I'm standing in front of our garden. Our garden is it's now in its 6th year, and we've been able to produce last year 1,600 pounds of produce on our front lawn over here. Now we're going to start walking towards our food pantry here. While we're walking, the food pantry on a regular day throughout this pandemic has been having on an average of about 20 families per week, per day coming in. We have volunteers staffing the food pantry all the time, every day for 2 shifts a day. And
there is some right here.
We have 2 volunteers staffing, and then actually I wanted to also show you, we have two pods right over here. Happens to be a rare quiet moment at the food pantry right now, but I wanted you to be able to see the 2 pods that we have to add additional storage space. And now we're actually in our food pantry where it's all happening. So JFS has been dealing with food insecurity for many years. Our food pantry has been in operation for over 30 years now, but we've never seen anything quite like this before. The amount of needs that are coming in on a daily basis are really unprecedented and nonstop. We've gone from averaging about 60 families coming in for emergency food, in addition to our 180 families on our monthly food program, and now we have about 250 families coming in for our emergency food program. So if you actually want to pull up the statistics now on the PowerPoint as well, we can do that at this point. So currently we have families from all parts of the county coming in on a regular basis. Perhaps one of the biggest changes that we've been experiencing is the number of people coming in for seniors who need the deliveries. We used to deliver about 30 packages per month. Right now we're delivering about 150 packages per month, and that number has only been increasing. With the help of volunteers, we've actually been able to add a number of volunteers delivering Shabbat packages as well, to kind of address the social isolation among seniors who are finding themselves exceedingly socially isolated without anybody to visit them, without any social interactions. We have volunteers who are bringing Shabbat packages every Thursday and Friday, and we've been averaging about 40 of those each week. So those numbers that's a completely new program as part of the pandemic response, and those numbers continue to go up. So how has the operation changed? Obviously, the numbers have changed drastically, but even getting food right now is harder than ever before. Food bank, which is where we historically we're averaging about 60% of our food. We're now struggling to get most of our food from the food bank. So we're relying on distributors to be able to get to be able to get about 90% of our food from different distributors throughout the area. And we have big trucks coming in almost daily with new deliveries. We were actually able to add in the two pods that I showed you out on the side of the food pantry. So that way we're able to store more food because there are concerns of certain items becoming a shortage of. And we want to make sure that we're able to provide for everyone. Another big factor has been the number of seniors who are more dependent on food assistance than ever before, obviously. It's obviously very well documented, but until you speak to seniors and who are calling and saying, literally, I'm hearing about seniors who, it's been reported they're having increased headaches, increased other feelings of exhaustion and other problems. And what we're finding is sometimes it's just due to a lack of nutrition and inadequate food. And we're obviously quickly doing our best to get food to these people. So the population has changed drastically. Another big area that the population has changed is we're seeing a huge increase of people who are unfamiliar with the system and unfamiliar with struggles. They've had jobs for many years. I was just talking to a proud husband of 3 children, and him and his wife both have had jobs for the last several years and had stability. And within a week, they both lost their jobs. They don't have SNAP yet, the food stamps, and they're both waiting for unemployment. Unfortunately, they don't have a huge savings, and so that they're immediately dependent on JFS just to get by from week to week. We have these food packages ready and ready to be given out at all times. These are actually our new produce boxes that we have, and we just packed 65 of these just today. Plus, we have emergency bags, just like this one, packed and ready to be given out at all times. So, food has been given out at a rate unlike ever seen before. We also, to accommodate the needs, we have volunteers here constantly, but we've always relied on groups of volunteers, synagogues and youth groups coming, federation groups coming. Now that we can't rely on groups, we've been much more dependent on ongoing volunteers. We have 2, sometimes 3 shifts a day for 5 and sometimes 5 days a week, and sometimes even on Sunday, with volunteers sitting here ready to help people get their food. Staff have been working here constantly to make sure that we're able to meet the growing needs as well. So, all in all, we've been just distributing more food than ever before. Together with our Lifelong Elizabeth program funded by the Grata Foundation, we've also been able to coordinate staff and volunteers distributing more food throughout Elizabeth and across Union County during this pandemic as well. So, I can't stress we've been in the business of helping people and helping people with accessing food for many years, but we've never ever seen needs like this before. We've never seen mothers and fathers coming in with children in need of diapers, which we have stocked and ready to go at all times. Families struggling to figure out how they're going to buy Shabbat food. We've been keeping the pantry stocked with chickens and other products. And so, it's really been remarkable. We've been relying on volunteers tremendously. Now I'm going to turn it over to Tom Beck, our executive director.
Good afternoon, everyone. Hello. First of all, I want to express my gratitude and the gratitude of the agency for the help of Federation in terms of helping us meet the tremendous need that Ellie had talked about. Because really, without the help of Federation, we wouldn't have been able, no way, to handle the numbers of individuals, not only on the food pantry program, which Ellie enumerated the amazing statistics of the people who have come through the agency. But as many of you know, the agency has had a Kosher Meals on Wheels program for the last 14 years. This Meals on Wheels program has been averaging about 85 to 90 individuals on a daily basis. And we distribute food from Elizabeth all the way to Berkeley Heights in New Providence. This happens on a daily 5-day-a-week basis. As a result of the pandemic and addressing the issue again of insecurity, those numbers increased dramatically over a period of 1 month. We added 40 individuals to the Kosher Meals on Wheels program. So yeah, we addressed the issue of the food pantry, but those astronomical increases also occurred from isolated homebound elderly who were afraid to go shopping, who were going to congregate meal sites at the Y or the JCC and can no longer, get out. And we stepped up to the plate and are delivering the meals. And when I asked Federation, for the gap funds to provide that support, the answer was always yes, yes, yes. We're concerned about food insecurity. We're going to help you out. And as is the true of Jewish Family Service at Central New Jersey, we're always good at seeking out other funding sources. So Federation has been in there providing the help with kosher meals on wheels and food pantry. But we're also applying for funding through Union County Division on Aging. And through the help of Federation, we've applied for FEMA, money specifically for the food pantry. So hopefully when you put all those pieces together, Federation funding, government funding, private funding, we've been able to put together a package to meet these tremendous needs. So again, my gratitude to Federation for providing this hope. What the future will bring, we don't see any end in sight. The numbers are increasing, not decreasing. As Diana Squadron mentioned, as unemployment and those bonuses that people have been getting, the numbers we expect only to increase in the future, not go down. So the help that has been provided has been tremendous, and we are most grateful to the assistance of Federation in helping us meet these many needs in the community. And Ellie and I are available to answer any questions or comments that people may have.
Hi, my name is, okay, hold on, sorry. Hi, okay, hi. My name is Kim Hirsch. I'm Executive Director of the Jewish Community Foundation, and I'm delighted to be here helping to co-host this seminar on food insecurity. So we are open to questions. Please put them in the chat. We already have 2 that have come in by a private chat. So the question for Tom and Diane is, what keeps you up at night?
Take that one first. And
Go ahead, Tom. You start.
yeah, no, I actually get a very good night's sleep. I do worry about the agency, but everybody knows me. I'm an avid exercises up at 5 in the morning, and I do a routine of meditation and eat a quick breakfast and exercise and do some good nutrition. We are in the food pantry and we do have good nutrition here. So in addition to working a lot of hours during the day, I also believe in self-care, and I take care of myself, not forgetting the many needs of the community.
So I certainly agree with Tom about self-care, and I'm a big believer in sleep as well. I could sleep for a nice long time, but I think both of us are concerned about the long range effects of this. This is not, as Tom said at the end, as I said when I was speaking, this is not going away anytime soon, and it's going to get worse. And even as the state opens up, the economy is getting worse and worse. More and more people are out of work. I don't think there's any sign that that's going to change, and our ability to continue to provide, excuse me, financial support and food for the community concerns me. I really want to make sure that we are able to be there and have the level of financial means to do that.
So I actually have a good follow-up question to that, and that is I know it's at this stage, it's very hard to do some projections going into the next couple of years because we just don't know what tomorrow is going to bring at times, but your best projection over the next 3 to 4 months, dollar-wise, what do you see your financial needs being?
And this is specifically for food insecurity.
Yes.
Yeah.
Yeah, I think we've been outlaying probably about $20,000 a month for food, not even including the kosher meals on wheels. As in, to put 40 people on kosher meals on wheels, the cost of that is $60,000 a year. So, and again, we're going to do our best to spread around, federation and government funding, because there has been some CARES Act, available, which we're definitely applying for and hopefully, procuring. But the numbers, for the food pantry and kosher meals on wheels, it's something that we've never witnessed before. And I don't see it going down. The seniors, for instance, will be the last to return to congregate, whether it's social gatherings or food shopping or what have you. They know they're the most vulnerable. And our agency, again, through Federation's help, through a number of wraparound services, which I'm not going to get into, has been primary in keeping people out of nursing homes, which has been responsible for 40% of the deaths in the state of New Jersey, and older people are aware of it. So kosher meals on wheels, food pantry, home health, nursing, all those services have worked together to keep people, particularly our seniors, out of the nursing home settings. And it's been absolutely invaluable. And also amongst our staff, because we took precautions right away, our volunteers, our social work staff, our nursing staff, our home health staff, there wasn't one case of transmission of COVID to one of our clients. So, and also I could say, Federation has also been helpful in that regard, because at the beginning we couldn't get masks, and our volunteers needed masks for this food pantry, as did our home health aides and our nurses, and Federation was there getting us emergency supplies of masks. So, the list goes on, but I don't see it ending.
Yeah, and I just want to add, in terms of immediate needs, we at JFS MetroWest, we don't have the food pantry, and we're not the ones in charge of kosher meals on wheels. But I think in terms of our monthly financial needs as they move forward for food insecurity, I think you're looking at about $5,000 or $6,000 a month for us. And again, that's tenfold what it typically is. And that involves making sure that we can expand beyond just our mental health clients or our DV clients, really into the community as a whole. I also want to add the importance of being able to provide the Shabbat dinners and the lunches to our older adults, our older isolated adults, and our seniors, and our Holocaust survivors. Because it's not just about the food when we do that. It's also about that very minimal amount of contact that we're providing that isolated older adult, that Holocaust survivor, with the outside world. And we've experienced that time and time again. Our volunteers have told us stories time and time again of going and delivering food and having someone be so grateful and sitting for 10 or 15 minutes or 20 minutes and talking through a screen. So it really becomes a combination. We've been very fortunate in our ability to provide Shabbat dinners, which isn't something that we had ever done on a regular basis before. And I don't see that changing. I agree with Tom. It's our older adults, our Holocaust survivors, who are going to be the last back in anywhere.
There's another question.
Wait, Jess, I'm so sorry. Just because some people have to go and we have lots of questions, before you go, there's a poll in front of you. If you could answer the poll and submit it, it'll take you like 2 seconds. For those who participated, thank you. And then we can keep going with questions because we have a lot. Okay.
So since we're talking about survivors, I'm going to take this question first, and then we'll wrap up with one last question before we go. So how many of your recipients for food aid are survivors?
So I would say for us, between the Shabbat dinners and the food shopping that we've done, probably about 70%. But as we're providing those services for more and more people, that number is shifting. So it's almost exclusively older adults, but I expect that there will be more and more that are not Holocaust survivors. Even though we're not stopping, with the Holocaust survivors. We're now providing services to isolated seniors who are not. For example, the care packages that we just did for the Holocaust survivors, we're now doing for our seniors.
And Tom?
Yeah, right now in terms of our Holocaust survivors, we have about 130 Holocaust survivors who would utilize the number of services. Many of them are on, kosher meals on wheels. Probably about 40 of the 130 Holocaust survivors are on kosher meals on wheels. So they get a meal on a daily basis. And on Friday, in addition to the Shabbat meal, most of them also get meals for the weekend. So they're actually getting, even though we're delivering 5 days a week, the survivors in particular are getting 7, meals a week. And it's also the survivors that we've done a lot of extra shopping for because they're terrified of going out because of past trauma and are particularly even more isolated than some of our other, seniors. So we've made every effort to use not only, volunteers, but also to utilize our staff because we've had transport drivers on staff. So we're utilizing them, not only taking people to doctor's appointments, but also doing shopping for them and dropping off food on an ongoing basis. So it's just been an ongoing effort to make sure that the needs of the survivors are met in addition to our other, seniors as well.
Thank you both. So one last question before we wrap up, because we do have our eye on the time. We're a little over, so briefly, are there any needs for this population that you see that you're not able to meet at this time due to funding?
I think really as a result of Federation funding, if we didn't have it, all of those services that I talked about, whether it's kosher meals on wheels, food pantry, the grocery shopping, the food drop-off, it just would not have been as extensive as it is. But it has been the policy of Jewish Family Service over the years, even before the pandemic, that nobody go hungry. It's a Jewish philosophy, that no one leaves the agency empty-handed. We give everybody, something, whether it's food or a kosher meal, or so. We've had a history of addressing food insecurity in multiple ways, but then as a result of the pandemic, Jewish Family Services Central Jersey really stepped up to the plate. But again, it wouldn't have been possible without the help of the Jewish Federation of Greater MetroWest.
Yeah,
Thank you.
and I just briefly, I agree with Tom. We're very grateful to Federation for the funds that they've provided us to be able to support the community. It's really hard to anticipate what's going to be coming down the line. I think in addition to food insecurity, funding, as Tom said, for helping people get to doctor's appointments, we're going to start seeing the need for funding for rent and utilities and other items that up until now we haven't seen. So one of the things that keeps me up at night is what's coming, what twists are coming down the road that we can start to think about, but we really can't yet anticipate how much it's going to be.
Thank you. So before I turn this over to Kim for some closing thoughts, I just wanted to let everybody know about one other food insecurity program that is brand new in our community. Federation, through our community relations department, did some really significant advocacy on this with partners across the state. And that is starting, I believe, now. It's happening now. It's funded through the USDA. Any individual who is hungry, no questions asked, can go to the Jewish Educational Center and pick up food boxes twice a week. And we are actively working now to bring that program into Essex County so that people from Essex don't have to travel. And I can, if you're interested in learning more about that, and I'm sorry, they are kosher meals for individuals who require kosher food. So if you're interested in that, want to learn more about that, I'm happy to have a separate conversation. So without further ado, Kim.
There's a couple more questions, and I'm sorry, I want to make sure the questions are answered. So they're coming to me via private chat. One is, are there any needs currently now not being met. I understand from what you're saying, Diane and Tom, that there's things in the future you can't even imagine yet, but that's one question. And the second question we've gotten is, I want to volunteer and what can I do to help? So let's try those two and then we'll wrap up.
Okay, go.
I was just going to say, so if you want to volunteer, Kim, and Jessica both, I'll send you the email of the staff person at JFS who is taking the information on volunteers and talking with them about what the different options are and sort of seeing where they would fit. So I'm happy to do that. We're always thrilled to have new volunteers. We're right now, today, we have the funds to be providing the gift cards that we need, right now. In July, I don't know. So it's a hard answer. I think in the long run, we're going to need more. And I think it's going to be immediate very fast. So.
What I would say in regards to the question of unmet needs, I think at the end of the day, when Tom and I are leaving often quite late, we're proud of how much we're impacting the community. And I'm proud of working with the number of volunteers that we have. It's been over 75 volunteers in the last month, and that's without a single group coming. But at the same time, I think it's inevitable that there are going to be some problems that aren't yet known of. I think there are still families that are too uncomfortable to come forward. There are too many people who are uncomfortable and don't know where to turn yet, and we're still finding out about those actually on a daily basis. Every single day I'm receiving more texts from community leaders and rabbis saying, I just found out about another family who was, remaining very quiet and private about it. So I think it's inevitable that that will continue. And I think while there is still a huge growing sense of optimism as we're hearing that the economy is going to slowly start opening up, I think at the same time, there's still a lot of people who unfortunately are ending up in a very, very big hole, and it's going to take months for them to get out of it. So that's the first response. But in regards to volunteering, there's no way we could be doing what we're doing without ongoing volunteers. As I said, we've had 75 volunteers, and the gardening season is just starting. This constant need for volunteers. We actually had 4 volunteers all working in separate corners of the garden this morning to ensure that we don't slow down in that area. And there's a constant need. So we've been getting it. We have an easy application online, and I'm happy to share that with anyone who's interested in volunteering. And we're very grateful to all the volunteers helping us meet these needs.
Thank you. Thank you, Diane. Thank you, Tom. Thank you, Ellie. Thank you for an amazing and very informative presentation. Just to wrap up, we're just honored the Jewish Community Foundation and the Center for Strategic Philanthropy and our Federation is honored to be hosting this seminar. I do want to let our fund holders know that to date, since March 1st, our Jewish Community Foundation fund holders have granted $2.8 million to COVID response. That is locally, to synagogues, to agencies, to Federation, to Israel, national Jewish organizations. Most of that is Jewish, not 100%. There are secular organizations in there as well. So we are just heartened and grateful for that incredible response of our fund holders. We like to say, these funds in some ways are there for a rainy day, and it is pouring. So I'm very, very proud to be a part of that and to be a part of the Jewish Community Foundation. Just quickly, the Center for Strategic Philanthropy is our arm of the Jewish Community Foundation that works with families on philanthropy, promotes Jewish philanthropy and multi-generational giving. I like to always say to people, those large banks with donor advised fund programs are not going to talk to you about Jewish camp and needs and food insecurity in our community and all these things and bring these kinds of resources to you. That's why we encourage donors who care about the Jewish community as well as the broader world to have a fund with the Jewish Community Foundation. And we're very proud of what we're doing. We are always open to hearing how we can do better. So please fill out that poll that you got or be in touch with us about other topics that you'd like to hear about. And thank you for joining us. And thank you to our excellent presenters.
Bye-bye.
Okay.